I always give you feedback after MRCS exam. Last week, we have finished exam around 350 doctors in MRCS exam part 2 in Four Season Hotel. The attendance was very good, but still there is a lot of mistakes of Egyptian colleagues due to communication skills and the environment of the hospital, which is not found in their practice. I will just give a quick example. Greeting to the patient is very important. Checking patient ID, introducing yourself, and mentioning that if you feel any pain or any discomfort, please let me know. I will stop the exam right away. If the patient tell you that I am in pain, immediately you say, shall I give you analgesic? Do you want some analgesia? Is everything all right? But don't continue the history while patient is in pain. Even if this was your own hospital environment in Egypt, you must have a totally different perspective about the exam. Also, we sometimes get a patient with photophobia, which he will come patient like this because he can't withstand the light due to subarachnoid hemorrhage. Usually it is an actor. So whenever you feel patient feels the photophobia, can I dim the light for you? Is that all right? Shall I do it right away? But don't to continue while patient have photophobia in front of a strong light. If the patient tell you that I'm drinking a glass of wine every day, when you summarize the history to the consultant, don't say this patient is alcoholic, because alcoholic is totally different story. A lot of the British patients drink wine on daily basis, and this doesn't mean that they are alcoholic. So I will form a lot of video about communication skills and common mistakes that Egyptian doctors fall into trap, which is an easy exam because I cannot imagine you going to MRCS part 2 and you fail a history station. Just taking a history and formulate a good, concise, well documented, disciplined history. Again, your habit when you take a history not to write it down. It doesn't look professional. You should write down the history points. So when you summarize it, you have a chronological order. And always ask permission of the patient. Is that all right? I'm going to write some notes and totally confidential. Is that okay with you? Again, very rare of Egyptian candidates have like this. I would like also to let you know that there is a lot of Indian, Sudanese, Jordanian, Kuwaiti colleagues coming to the exam because instead of going to London, the competition in London is very tough. But the competition in Cairo exam is less tougher. So you can have better chance if you go to Egypt exam. I will be also examining in London next February. I wish everyone best of luck, but I don't recommend you going to London exam because the competition is much fiercer than in Cairo, and the cost is a lot higher. And we will have three times MRCS examination part 2 in Cairo, March, in May, and in December. And all of them are found on the website, and I recommend you all to get the MRCS exam. It will open a lot of doors because there is a huge defect in vascular and general surgical doctors in United Kingdom due to exit of European Union, which have I think about 20,000 doctors from European went to their country and left UK, and a lot of UK graduate left to Australia for a higher income, so also left UK. So there is a very high demand for doctors. It's an easy approach. MRCS exam part 2 is very easy if you know how, and I will try to summarize a lot of tips and tricks how to pass the exam. I wish you best of luck, and I hope you will benefit from this video, and I hope by following this channel you will get the most updated information that that will help you in your vascular career. With all my best wishes. Thank you very much and best of luck.